Dr. John here with Facebook Live, NBC News. I'm going to be talking to you about a couple of coronavirus headlines you've probably heard over the last couple of days, and then answer viewer questions. So please, if you have any questions, send them to us, and I'll try to get to as many of those as I can, because it turns out you guys have fantastic questions and things oftentimes I don't even think about, but are great for people to know and understand about this coronavirus outbreak, this coronavirus pandemic. And as you know, we've been doing this many days because this thing has been going on for quite some time. It looks like we're making a little bit of a turn here. And the reason I'm saying that is because Governor Cuomo from New York State went on today and he said it looks like we're flattening the curve. It looks like we're making some headway. Other states, we know a similar thing is happening. California, Washington, they also say it looks like they're flattening the curve as well. The reason that is happening is because people are doing the things they're asking of them to do. They're doing the social distancing, that 6-foot distance. They're wearing masks when they're out and about. Only essential workers are going to work. Other businesses are closed down. But on top of that, we're all doing the stay at home, the shelter in place, which is certainly helping. This week is going to be difficult for all of that because of the Holy Week, Easter, Passover, times when families tend to get together. And so this is one of those weeks where it's better to do that virtually, so as best you can do over the internet. And if nothing else, pick up a phone and call somebody. They would love to hear from you, especially those friends you haven't heard from in years and years. But what Governor Cuomo said in his press briefing is a couple of things. One is deaths are rising. Today was one of the highest rates of deaths, and they seem to be rising over the last few days. They've gone up. Numbers have gone down, and so that's the important thing they're looking at. The cases starting to look like they're flattening, so that's good. And if those cases start flattening, then I think we're going to make some headway out of this. On top of that, we're also finding out that this antibody test that everybody's talking about seems to be around the corner, seems to be happening sooner rather than later, and hopefully by sooner we mean within a few weeks, because the antibody test is going to give us the ability to test people on a general basis and say, yes, you were exposed to it, yes, you have antibodies, and so it looks like you're at least partially immune to it for some time, so let's get you back to work, let's get you out of your house or your apartment so you can get out and do your things. But part of the thing that all the experts are struggling with now is what to do, how to get people back to working, how to get our lives back to semi-normal. And what most experts are saying, and what I think too, is we're going to see near normal this summer. We're going to see near normal this fall. We're probably going to have to fall back to some of the things we're doing now, the social distancing, maybe stay at home, masks, those types of things, because coronavirus is going to make a comeback. And experts are actually now saying they don't even think it's going to go away this summer. And I'm going to address that on Nightly News, what that means. As far as the antibody testing, I'm trying to get a Facebook Live together, what I call Doc to Doc, that's going to have a Facebook Live with an expert on antibody testing to kind of walk us through all that. What does that mean? So stay tuned for that as well, because I think it's going to be very informative, because there are some tests out there. The FDA is warning, essentially all the tests have not been approved. There's one that's been approved. It's a laboratory test. It's not a take-home test. And so again, anything you hear about, hey, here's something we can send to your house, it's approved, you can go ahead and use it, don't listen to that, because the FDA is saying absolutely not. But again, we seem to be making headway. We're doing the things we need to do. We just need to keep doing those. Another week or so, and hopefully we'll start to see that light at the end of the tunnel, and we can start releasing things. And that's what they're looking at now, how we can start releasing people to go back to work, to go back to their lives, and get as close to normal as we can. Especially, I know people are really wanting the sporting events, they're wanting restaurants to open, theaters to open, movie theaters, those types of things, because most of us, myself included, getting a little cabin fever sticking around the apartment for so many days on end that you just want to go out and do something. You want to get back to what your normal life was, and you want to get around friends, which is extremely understandable. But let me see if we have any questions here so I can go and answer them, and we'll try to get to as many as we can over these next few minutes.
Are the ill and death rates accurate?
So the question is, are the ill and the death rates accurate? To a certain extent, the answer is kind of a yes-no type situation. What we're finding out is that people that are getting tested, we're finding out that a certain percentage of them, they think it's around 10%, are testing positive for coronavirus. Depending where you are, that percentage goes higher or lower, but overall around 10%. Problem is there's a lot of people that aren't being tested, and they have what we call presumptive symptoms, meaning we think they have coronavirus, and so maybe, but they're not necessarily being put in that tally of who has it. So those numbers are probably much lower than we think they are. We think they're going to be much higher if we were able to test everybody. In no situation will we be able to test the whole country constantly, week after week, to find out who's getting it or who's developing it. But we can do surveillance tests. That's what we're waiting to do. And once we get those antibody tests, it'll tell us for sure. As far as the death rates we think are more accurate. But part of the issue is, especially in very congested areas, the New Yorks, the San Franciscos, the LAs, the bigger cities, the Chicagos, is a lot of people are dying at home. And so those people dying at home aren't necessarily included in there. And if somebody dies of, let's say, a heart attack, but the heart attack was caused because they had COVID-19, but they stayed at home, would that be included under COVID-19? It depends on how those are recorded down. So again, it's not as accurate as it could be, but it's as accurate as we can get it right now. I think what they're going to do is over the next months and years, when we start looking retrospectively and say, what are the things we did right? What are the things we did wrong? What can we learn from this? They'll also look at those numbers and make better estimations, because as we've talked about modeling, those estimations, they're only as good as the assumptions or the data you put in there. The more data we get, the better those models, those assumptions, and those estimates will be.
Should we be wearing gloves?
This is a question I get quite often, because we know we talk about masks. Should we be wearing gloves? That's the big question. So masks, and I have my own here. And shout out to my wife's cousin Julie for making these, and her son.
Jack.
Her son Jack made this one as well. It's got some sushi on this side, some chilies on this side, and I wear it when I go out and about and then wash it in between. Fantastic. Thank you, Julie. Thank you, Jack, for putting it together. We know masks can help a little bit, because masks help prevent people who might be what we call asymptomatic carriers. They're not sick, but they have the virus, from spreading it to somebody else. We also know they can spread it by breathing or coughing or sneezing. The breathing part, I think, is taking a few people by surprise, but you have to be much closer. And the best way to think about it is, if you want to know how far the breathing goes, think of those days when you're out in cold weather and you get that mist from all the cold weather when you start breathing. That mist is the vapor that comes out of your breath. Those are the droplets we're talking about. So if that mist only goes out this far, somebody'd have to be that close to you to get it. That's why masks are important, especially, again, if you're coughing or sneezing. But as far as gloves, people are saying, should I be wearing gloves outside? My general answer is no, unless you're in a business or an industry or a healthcare setting where you're going to be exposed to a lot of pathogens, not just this. Here's the reason. For COVID-19, for coronavirus, it does not get through the skin. And even if you have broken skin, if you have cuts or anything like that, it's not a bloodborne pathogen, so it doesn't seem to be transmitted by blood. On top of that, people don't necessarily take the gloves off appropriately. So I have a pair of gloves here. Let me show you how we learn to take these off. They teach us this in school. And these are what are called nitrile gloves. They're a replacement for latex gloves, because some people, frankly, have latex allergies. But the best way to take them off, like say I have them on and I'm working and I'm doing all sorts of stuff, and these are dirty. They might have coronavirus on them. The problem with gloves are they can give you this false sense of security, so people could touch their face. And if they do, and there's coronavirus on their gloves, it's going to get in their face. On top of that, when they take them off, if they don't take them off correctly, they get coronavirus on their hands, and then they have to wash their hands anyway. So washing your hands if you're out and about is the best thing to do, or using alcohol-based hand sanitizer. If you're in a healthcare setting or some other setting where you're going to be around other pathogens, other types of viruses and bacteria, then it's a good idea to wear gloves. But for most of us, no. But if you do wear gloves, here's the way to take them off. Here's the approved way. So I'm just going to roll my sleeves up so you can see it. So essentially what you want to do is you have gloves on both hands. You don't want the outside of the gloves to touch your skin. So what you end up doing is you take this glove and you pinch it right here on the inside of your wrist. When you pinch it, I'll show you here. You just pull the glove off. Boom, pull it off. And then go ahead and bunch it up in this one hand. So now you have all the gloves in this hand. This hand is clean. So you do not want to touch the outside of this glove. So what you do is you reach inside with your finger, index finger here, you can use one or two, reach inside, pull it across, again, just touching the outside of the glove, and then just throw that away. And once you throw it away, wash your hands just to make sure. But when you do it like that, you touch nothing on the outside of the glove. None of that gets on the inside of your hands. That's the way you dispose of them. You take them off and dispose of them. And a shout out to for other people, please, if you dispose of them, put them in some kind of trash receptacle. Because a lot of places you're seeing them just littering the streets. Please don't just let them litter the streets. Please put them in a trash receptacle. Nobody wants to have to deal or have to see that. But again, gloves, not necessary unless you're in those situations where you're exposed to other pathogens. Masks, you should wear them when you go outside, because you could possibly be an asymptomatic carrier or around somebody who is an asymptomatic carrier of coronavirus. So we just all need to be careful. So, any other?
Why is that Q-tip for the test have to go way up in your nose if it's so...
And that was one of the issues that came out early, is the test. So some people described it as, it felt like they were piercing my brain. It was the most uncomfortable thing. And typically as doctors, what we'll do for tests like this, where we have to go very far back, is we'll rest somebody's head against a headrest. And so when they were driving up in cars, they're having them rest against the headrest so they could get the swab back in there. Contrary to popular belief, if you notice it, they stick the swab straight back. They do not stick it up. The reason is because your nose goes straight back. It does not go up. It goes back, and that's where the nose cavity is, the nasal cavity. and it meets the throat cavity in the back. So the reason they have to get it so far back there is that's where the virus rests. If they do it just up front, the virus might not be there, but they know it's going to be in the back. And so they get the swab very far back there, swirl it around and pull it out. Then they'll do oftentimes the throat too and use both of those. They're coming out with tests they say look like they're pretty accurate, where they don't have to go quite as deep. And that means it won't be quite as uncomfortable. But depending on which test you get, you might go all the way back. It might only have to go part way back. But neither of these are comfortable, and patients will tell me time and time again, and I'll tell them before I do this is not going to be something you or I enjoy, but let's go ahead and get it over with. So that way we get the best specimen possible.
Does zinc work as a prevention measure?
So a big question about zinc as a prevention measure. Does it work? So here's what you know about zinc. If you remember a few years back, there was a zinc nasal spray that seemed to work very well. First and foremost, I'll say that nasal spray has been taken off the market. Do not use a zinc nasal spray. The reason behind it is that even though it seemed to help a little bit with something I'll talk to you about here in a minute, it was causing some people to lose their sense of smell, and they lost that sense of smell permanently. So you can imagine not having a sense of smell, which is also going to interfere with your sense of taste, and losing that permanently. That could be a big change in your life. And so that was taken off the market. Do not use anything that can put zinc up your nose. But as far as zinc lozenges, could it possibly help? It looks like, at least in some situations, it can help because it doesn't allow the virus to replicate, especially in the back of your throat, where we talk about the virus hanging out. The issue is we know it works for some colds, and what it does, it doesn't prevent you from getting the cold, but it can reduce the severity of the symptoms, and it can also reduce possibly the duration of the cold. Doesn't mean you're not going to get it, it just means it's not going to be as severe or as long. Coronavirus is a type of virus that can cause colds, along with something else called a rhinovirus. So since a coronavirus seems to be affected by zinc lozenges, it looks like this coronavirus, at least some people are saying, possibly as well. Such a new virus, we don't know. But if you do decide to take zinc, remember you can get zinc overdose too, so be careful, follow the instructions, don't take more zinc than you should. It's one of those things that, again, possibly could help, probably does not hurt unless you take too much. So it's your decision whether you want to take it or not. But again, it's not going to stop you from getting coronavirus. You still need to do those other things we talk about. But if you get it, at least with other types of coronaviruses and rhinoviruses, things that cause the cold, it can reduce the severity of the symptoms and possibly the length of the actual symptoms themselves.
Can you talk about tests, the false negative tests? Is it true that 1 in 3 are false negative?
So the question is about false negative tests, and here's what happens with testing. There's two different things. There's obviously 4 things that can go on. You can get a true negative, which means you don't have it. You can get a true positive, which means you do have it. But then you can get a false negative and a false positive. The difference there being is the false negative, essentially what happens is you have coronavirus, but the test says you don't. It's a false negative. Same thing with the false positive. False positive says you have coronavirus, but in fact you don't. That's when things come in and it starts causing some confusion. In a case like this, the false negative is worse because we're telling you the test is saying no, but in fact you have it, so you could expose other people to it. So you have to be careful with that. The false negative rate is fairly low with coronavirus, and we know with most tests, false negative rates can be high. And so it's one of those things, especially when tests first come out. There's a strep test, rapid strep, if you've ever gotten that. 20 years ago, when we were using rapid streps, we used to always tell people that 15% of them have false negatives. And so it's given us kind of a clear picture, but we would also go off clinical symptoms and say, even though the test said negative, I don't believe it. Those tests have gotten much, much better. But that's been over a 10 to 20 year period. Remember, this test has been out just for a few months. And so it's going to take time to fine tune it to the point where it doesn't give as many false negatives. So essentially, as clinicians, what we say is, even though we tested you and it looks like it's negative based on your symptoms, based on your history, I'm still telling you, you might have coronavirus. Let's go ahead and treat you, pretend like you have coronavirus. We'll test you in a few days to see if it is in fact coronavirus, because typically once those viral loads pick up and you've had symptoms for more than a day or two, it starts becoming more accurate. And so again, not as accurate as we'd like, but it's only been around for a little bit. It's going to get more accurate.
What are some signs that things are actually getting better? When will we see those?
So the signs of things actually getting better, and like I talked today with Governor Cuomo was saying essentially that even though death rates are going up, those cases are coming down. The reason that's happening, and the reason they're saying it looks like we're flattening the curve, is because if you remember the coronavirus task force, Dr. Fauci has said this a couple times, the way things are going to work over time is first you're going to get cases. Once you start getting people who are sick with coronavirus, then you're going to get people who are hospitalized. So that follows. First they get sick, then they get hospitalized a few days later. Once they get hospitalized, then a few days later they go into intensive care unit. Not everybody, but people that get an intensive care unit first got sick, then usually got hospitalized, then intensive care. And in intensive care, it's about a 2-week lag before people start dying from coronavirus. And so what you're seeing right now with the deaths going up are people that actually got coronavirus 2 or 3 weeks ago, or maybe even longer. But the people getting cases right now, which are dropping, are the ones that are going to get hospitalized in a week or so and hopefully not die, but potentially die over the next 2 or 3 weeks. And so it gets a bit confusing, but essentially what's happening is the deaths are lagging behind by a couple weeks. The cases are what we look at, because the cases mean that they've only been infected for 5 to 14 days, because those symptoms show up. Once we start seeing those case numbers come down, then that's when people start saying it looks like we're flattening the curve. Even though over the next few days, death rates might still continue to climb, they're going to eventually follow the case rate and start declining as well. So the last thing you look at are the death rates. The first thing you look at are the cases. And that's why they're saying it looks like things are working and we're flattening the curve. Another thing today, if you remember, last week they said the estimations for the deaths were going to be between 100 and 240,000, which I think took a lot of people by surprise and said, that's a lot. Even they said, regardless that we're doing everything right, we still might have that number. Well, this week they came out and they said it looks more like that number is going to be probably 60,000. And so that's a huge change. The reason for that change is we're getting more data into these algorithms, into these estimations, these models. We're getting more accurate information, and it looks like the things we're doing are actually working. So that's a big way of saying keep doing the things we're doing, because that's something that's going to work, and that's something that's certainly going to help out. So again, some good news. There's glimmer of hope. We look like we're flattening the curve, even though you can see those deaths going up. Those deaths will start coming down, and that's the end goal here, to make sure that people don't die from this. But it means doing the things that we all know we need to do: social distancing, staying at home unless you're an essential worker, covering up when you cough and sneeze, those types of things that we can all get this under control, regardless of where you are. If you're in a big city, if you're in a small rural area, we all need to do the same thing. So thankfully, thank you guys for doing the things you're doing, because it's certainly helping out. Need you to do more of it. Have a fantastic week. And I know for some people, it's their Holy Week, it's Easter, it's Passover. So best with all of those, and enjoy the rest of your day. Stay safe.